I believe the most important thing that we were able to provide University Hospital was really just a sense of hope.
And help them grow as a hospital.
And it was the speed at which we were out the door.
Me and my team, we went to the ER and we just started working.
We were only on ground providing medical care for approximately 6 weeks. However, this was an immensely impactful 6 weeks.
Do you understand the magnificence of what you have just done? You are about to go into war. This is our war. Never in the history of the United States military has medical been the war fighter. But we are the war fighter. We are the tip of the spear. The active duty has sent out what they can, and now they have called upon us. Army Reserve Forces trained to respond to the nation's call whenever and wherever it's needed. For many, it was assumed that that call would be in some faraway place against a near-peer adversary. As it turned out, it would be in a place we never thought we'd go against an enemy we never expected to fight. I am Major General Joe Robinson, Commanding General, 3rd Medical Command. The original concept of the Urban Augmentation Medical Task Force, called UAMTF, was to provide health, safety, and emergency medical support of U.S. persons as a response to large environmental disasters. When the pandemic swept the nation, an expectation was set forth from then Chief of the Army Reserve, Lieutenant General Charles Luckey, to expect that the Department of Defense would call upon the medical capabilities of the United States Army Reserves. That same day, the mission of the Army Reserve became the COVID response, and we have answered that call. 3 days later, a new order was received. Rather than assemble hospitals, a new unit envisioned by Major General Michael O'Gwen was to be formed, a new design that could be scalable and adaptable. The UAMTF is an 85-person unit designed to support up to 250 patients. It consists of physicians, nurses, dentists, environmental scientists, combat medics, behavioral health specialists, occupational therapists, pharmacists, dietitians, physician's assistants, respiratory therapists, and administrative personnel. The soldiers from UAMTF 332-1 come from 11 states and work side by side with civilian medical personnel in areas throughout University Hospital in Newark, New Jersey. Understanding that Army Reserve soldiers have unique skill sets that combine both military training and civilian expertise, the unit command team leveraged each of their soldiers' skills to creatively fill critical needs. There's always been a question of relevance. Can we get the Army Reserves to the fight to make a difference? Can the Army Reserves be available in days and weeks rather than months and years? The response to COVID-19, the largest domestic mobilization in Army Reserve history, demonstrates the Army Reserve's ability to rapidly adapt to a wide range of contingencies at unprecedented speed. Our response to COVID proved that the United States Army Reserve Forces can meet the challenges to make us immediately relevant in any conflict. The soldiers you will hear from describe the very real conditions they encountered and the skills required to combat this, at the time, a much unknown enemy. Their stories represent only one example of Army Reserve medical capabilities.
So just prior to mobilization, a bunch of calls were made to all the soldiers to not only see who would be willing to volunteer to attend, but also to see if they were a critical need to their employers, right? Or if they were already involved in providing care for patients with COVID. So our leadership really wanted to ensure that they were not taking critical resources from other communities that were already in need.
When we first arrived, we very quickly realized just how desperate the facility was for us to be there. The nurse-patient ratios were very high. The patients were extremely sick. And it's one thing to witness and see a lot of what was going on the news or on television, but to be there and to see it firsthand was a very different experience. And it was very eye-opening to see just how sick this virus can make individuals.
We're talking about places probably designed to, on a normal day, handle 50 people, and that's just about it. But by the time we got there, they were holding their 50 in their basic places, but they're also adding an additional 45 to 50.
When I did my first shift, it was very intense. I felt like I was drowning, and I was just trying to keep all of my patients from drowning with me.
As a civilian, I work as a medical surgical ICU nurse at Tampa General Hospital, and that level of training and expertise was of the utmost importance, especially during this time when there were so many critically ill patients. Many of us as ICU nurses were able to easily integrate into the critical care float pool and go from ICU to ICU, providing just the care and services that the hospital needed most.
I work as an RN in the civilian world, and I work in psych and med-surg, so I got planted on a med-surg floor at University Hospital, and I think that my skill set really helped me because mental health came into play a lot during the pandemic, and it still is. Trying to do everything with all of your PPE donning and doffing before going into every room. All the doors are closed. Not everyone is hooked up to a monitor, so you can't really see the patients or how well they're doing, and we were seeing patients crash fairly quickly. So it was all just very, very stressful.
Being a family nurse practitioner, that's what I do in my civilian occupancy. I treat patients, triage them, prescribe medications, etc. So for me, it was a pretty much smooth transition. You know you're going to be in personal protective equipment, literally dressed from head all the way down to your feet. And it's very hot, and it's kind of reminiscent of the old Mach 4. Sorry just doesn't say enough for these people of what they're going through. And so I think that was probably some of the hardest things to deal with.
I think once we got there, the staff realized that they had been through the worst of it and that help had finally arrived, and they had reached the peak and they were slowly climbing over to the other side of the mountain, and that we were there to help them get down. As a critical care nurse throughout this whole experience, one of our most rewarding times was when we got to extubate a patient. When a patient was strong enough and their lungs were healthy enough that they could breathe on their own again, and we were able to take the breathing tube out. And I know every last one of us remembers that one patient that made just this sudden turnaround and got better, and we knew that we were a part of it.
Things were starting to catch up, hospital capabilities were starting to balance out.
I think that we brought a lot to the table coming to this hospital and really, truly helped them.
Yes, we were sad on that day because we were leaving our friends, but we knew that we were there and we did something good.
Everyone was just willing to help. It was really an amazing example of teamwork in action, and I have never really seen anything quite like that in my 20 years of military experience. So it really made me proud to be a member of the Armed Forces, even more so than I already was.
Embedded in hospitals across the Northeast, these service members were responsible for providing expert medical care that brought immediate life-saving results throughout the hospital. With the assistance of Army Reserve Medical Command, ARMEDCOM, the 3rd and 807th Medical Commands assembled 15 UAMTFs and, as ordered, had them ready for movement in a matter of days. Ultimately, 17 UAMTFs were formed, 10 from the 807th, 6 from the 3rd, and 1 from ARMEDCOM. Army North employed 14 UAMTFs in response to COVID-19, utilizing them in alternate care facilities in the Jacob Javits Center, the Edison Expo Center, Atlantic City Convention Center, and in area hospitals in New York City, New Jersey, Connecticut, Massachusetts, Pennsylvania, and Michigan. As civilian hospitals were devastated by the virus, speed was an essential part of the response if the Army Reserve was to make an impact. The call-up began immediately with the largest stipulation that if a soldier was already engaged in a COVID fight in their own homes, their priority was their local community. Despite this and a show of patriotism and service, soldiers by the hundreds dropped everything and moved to their home stations, where in just a matter of days they were in process, taught proper techniques and personal protection against the virus, and deployed into the fight. The Army proudly and proactively supports the whole-of-nation COVID-19 response, communities in need, and civilian authorities with any natural or man-made disaster. Our soldiers bring specialized military and civilian skill sets, allowing them to increase the capacity of civilian hospitals and alternate care facilities. The Army is leading transformational change and remains ready to fight and win our nation's wars on any battlefield. This was a medical fight. The Army Medical Department answered the call just as it had trained to, and showed beyond a doubt the capability of the Army Reserve Forces and their relevance in any conflict.
Be proud of what you've done. Be proud of what you are doing. You are patriots. You are true Minutemen. And I cannot tell you the pride that I feel when I stand and see you ready to go out the door in less than 48 hours. God bless every one of you. God bless every one of your families for letting you do it.